This time of year, many people are working on all kinds of New Year's resolutions, getting organized, planning for the future, advanced directive documents, and making your healthcare preferences known. Well, that's something that should be on the list as well. Dr. Elizabeth Golding, Medical Director of Cone Health Palliative Care Services, is guiding us on that topic today. All right, so let's just start from the beginning. When should we all start thinking about advanced care planning so we can start that with our families and with our own kind of mindset?
Yeah, sure, Tanya. Thanks for having me today to talk about this important topic. Advanced care planning is really an activity for any adult. So you can actually begin advanced care planning at the age of 18 when you're able to make your own medical decisions. And we really encourage advanced care planning to start that early. Unexpected accidents can happen at any age. And it's important to think about things like who you might want to speak for you if you are unable to speak for yourself. Too oftentimes people don't have these things in place, and when they're facing unexpected medical crises, they have to make decisions under pressure. And so we really encourage people to think about this ahead of time.
Yeah, because you are the only person who knows what you would choose to do.
Absolutely, and it really is a way of it's a point of empowerment for people. And we plan for all kinds of things throughout our lifespan. We plan for the birth of children, we plan for college, we plan for retirement. The one thing we often fail to do is plan for what might be the end of our life. It's also the point in our life at which we may be most vulnerable. And it's not just for the sick or the very elderly, but it's also for anyone who's young if they're, face an unexpected or trauma or crisis that couldn't, be anticipated.
Sure. Okay, so let's kind of go down the list of what forms are you referring to that everyone should have and complete?
Yeah, so what we're talking about today really is advanced care planning in terms of a living will and healthcare power of attorney. A living will document in the state of North Carolina allows people to express their wishes should they become severely incapacitated, so unable to really think or speak for themselves. The most important part of the documentation, in my opinion, is to identify also a healthcare power of attorney. So this is someone a trusted individual. It doesn't have to be even a spouse. It's whoever you think would be the best person to make decisions for you if you were unable to do that for yourself. Outside the documents, the most important thing is really the conversation that you have with that person. It's not necessarily like a one and done thing. Sometimes people worry once they put this in writing, it can never change. These are dynamic documents. They can change over time, and you can also you can even change the people you choose to serve in that role for you, and they should be updated at regular intervals. But anyone can be named your healthcare power of attorney that you trust and feel that would act on your behalf in the event you are unable to speak for yourself. Sometimes people worry that if they do these documents that they lose their voice. That is not how these documents are designed to be. You maintain your voice as long as you have it and are able to communicate and have capacity to make your own decisions. You will always be in control of your own choices. However, these documents are important if you ever get to a place where you're unable to do that.
Yeah, I mean, what happens if you got into a car accident and you were unable, you were out, right? And someone needs to make the choice,
Right.
are we going to have surgery? Are we not going to have surgery? That kind of thing. Okay, so when
Exactly.
you talk about these documents, they seem, like you said, that they can be changed pretty frequently if we want to be able to do that. How do we get our hands on those documents? What's the process?
So we make it pretty simple for patients at Cone Health. You can access those documents through our advanced care planning website, which is conehealth.com/advanced care. And if you will go to that site, you can actually download the documents. You can also access those documents through MyChart app. And if you're uncomfortable with those types of platforms for downloading documents, I encourage everyone to discuss it with your primary care provider. Our primary care provider practices are equipped to help guide patients through that process and also help with any decision making or legal things that are needed to complete those documents.
All right, and that website that she talked about, that Cone Health website, we're going to be putting that link into the story, and we're going to be posting this interview on our website later on this afternoon, so you'll be able to have that. Why are forms so important versus just saying, I want you to do this for me if something should happen?
So the forms really are important because a lot of times patients and families will say, well, my family knows what I want. They know what I want. But under the pressure of a medical crisis, people have a hard time speaking that or articulating that. And so the documents really give not only families a sense of security, but it really is a gift you give to your families to go ahead and have it in writing, so that there are no questions. And also for the medical team, we at Cohen Health take these documents very seriously. We store them in an easily accessible electronic form within the electronic medical record. So you don't have to keep them in your safe deposit box or somewhere hidden away. We will have them easily accessible for you if you have those forms completed. We really strive to make sure that we do that in this system so that not only are we talking to the right people in the event of a medical crisis, but that we have your wishes documented and can refer to those if needed.
We did talk about how having the documents is key. Not just talking to your family about it, saying, hey, I know you'll do what's right. You definitely want to have the documents. Now, once we have the documents completed, we do still need to talk with our family about those documents.
That's correct. The conversation really, it's a tough one. I think people really, no one really likes to talk about end of life. It's normal. We're human, and we, it's a difficult subject to talk about. And sometimes people won't bring it up because they're afraid it will cause their loved ones sadness or grief or just the thought or the idea of that happening. But I always encourage people to focus on the gift of clarity to your family. So letting them know your thoughts on something around how you want to be cared for, what if situations are really good to talk about. And it doesn't have to be a super heavy conversation. And you can kind of start with saying, there's some important things I want to talk to you about life and planning. When's a good time for us to do that? Sometimes people bring it up, at the Thanksgiving dinner table or, with everyone and say, we are going to talk about this. They make a big deal about it. But really, it's a personal decision how you bring it up. But I do find that once people do it, they feel so much more relief about having it done and the clarity and the reassurance of knowing that they have identified a person to help make decisions when they can, and also to have that document that says things like, I wouldn't want to be on life support if I couldn't think or speak for myself, or if I had an injury or an illness that I couldn't recover from. I don't want to be a burden on my family. To be able to say that to your loved ones when you've got your mind about you and you've got your capacity, you're not in the throes of a horrible illness, is so much easier to do it when you're well than when you're really sick and vulnerable. And so I do encourage people to have those conversations early with their loved ones in the event that there is serious illness.
Okay, we've got about a minute and a half or so. What is a misconception maybe about advanced care planning that you would like to set straight while you have everybody here listening?
I think sometimes people assume that if you complete those documents, it means you want to give up or that there's some limitation that'll be placed, on your care. It could not be farther from the truth. These documents truly are meant to protect you and to make sure that your best interests are served in the event of a serious illness or a life-threatening illness, where you may be facing very difficult decisions about how you live for the time that you have left. And it really does provide reassurance, not only for the providers caring for you, but also for your families. There's nothing more agonizing for me as a physician than to see a family really struggling with these decisions. It tears families apart when they don't have that clarity. Maybe they don't agree. When really at the time the focus should be on something other than that. If we can get that discussion had up front and we kind of know what someone's wishes are, it makes for just a much smoother care pathway. It also helps families have peace and dignity and reassurance in knowing that they have fulfilled the wishes of their loved one, and that burden doesn't rest on them, and it doesn't rest on them for the rest of their lives. It was something that had already been spoken about. So it's very powerful when people do have these conversations and documents. It always gives me a sense of relief in saying, wow, this person did well for their life by talking to their family. So I really encourage everyone to have these conversations. Most people feel much better after they do it.
All right, have the conversation and get the documents going so that it is more than just a conversation, that it actually is known for those who are taking care of you as well. Thank you so much for joining us. If you missed any of this, if you want to send it to somebody else, this is going to be in the To Your Wellbeing section on our website.